Hello again, another weekend and staying home. This is a little bit of an update on the COVID-19, or maybe we should call it a virus from Wuhan, China. Uh, some of the information may be a little bit technical and maybe a little bit medical, but I think if people will give enough attention, they can understand the simpler way of explanation for this. So far, the American lives lost are about 37,000 plus. We have more than 700,000 cases, and various treatments have been tried, including plasma. And we also have tried hydroxychloroquine, number of other drugs, chloroquine, zithromax, zinc, and many others. But my goal is to kind of make you understand why is this disease causing more problem than average flu or average viral infections. And the explanation is kind of mixed. Certainly this particular one has a more infectiveness. That means it infects more people than average flu does. Originally we thought that it was infecting, one person could infect about 2 plus or 2 point some number of people. Now it looks like that one person can infect almost 5 people. So that's why it is more infectious than average respiratory infections. Number 2 is that because it has that high infectiveness, and we have realized that aerosol spread from one human to another human can occur, we are having problem. So in the past, if somebody came into the hospital and needed an oxygen because their oxygen level was low, we started them on an oxygen through a nasal cannula. We would increase the nasal cannula from 1 liter to 2 liters to 10 liter to 15 liter. And with the newer technique, we could even go up to 40 liters or more. If that does not work out, we put a pressurized mask, like people who have sleep apnea put it on. It's called continuous positive airway pressure, or CPAP or BiPAP. And even in addition to that, we could put people on what is called non-invasive ventilation. Many of the patients who have respiratory difficulties are on oxygen at home, are on CPAP at home, are on BiPAP at home, and some are also on non-invasive ventilator without having a tracheostomy or actually a tube placed in through their throat into the lung or trachea. Unfortunately, with the fear of aerosol spread, after 6 liters of flow, lots and lots and lots of patients are intubated, which means they are sedated, paralyzed, put on a respirator. Putting younger people on respirator like that necessitates use of several sedatives, pain medications, and paralyzing agent, which causes more problems with the getting rid of the secretions and collection of them, etc. And that may aggravate the problem. Today only I saw an article or an information from New York where 30% of the patients who were admitted were put on a respirator in ICU. Again, it looks very high, and the simple reason is we are intubating, putting people on respirator rather quickly. I actually stated to somebody that if somebody has a diabetes, and I'm just doing a comparison, and initially we do a diet control, weight loss, then we put them on pill form of medication that reduces sugar. We increase the dose, we add another one, and if that doesn't work out, then only as a final thing, we put people on insulin. But think about if I would start putting everybody on insulin right away, without trying anything after the diet, we will have more people on insulin. So when we say that we are having more people put on a respirator, it is by choice and not necessarily because the condition is worsening. However, the condition has worsened quite rapidly compared to other diseases, but I've seen that also with other pneumonias. So there are both things. The virus is more virulent, the virus causes rapid decline, and virus does need respirator support. Something a little bit technical. When you think about pneumonia, usually the fluid is filling the air sacs, and that's why oxygen has difficulty. So the problem is more with the ventilation, air getting it through the alveoli, which are filled with inflammation and fluid. It appears that these kind of lungs are stiff because it's like a lung is like a dry sponge. But when you fill with water, it becomes stiff and the oxygen cannot get through. So when you deliver the oxygen under pressure, it can be pushed through this fluid or inflammatory secretions in the alveoli and it gets in the blood. This is not exactly the same thing happening with this particular virus, and what is actually happening is the lungs are not that badly stiff. So it is not only a problem of ventilation, but it is a problem of circulation, the blood going to the alveoli. The small tiny capillaries are getting clogged up with clots. So if you think about a game of football where there is a ball which is thrown, if the pass has to be complete, there must be a receiver. If no pass comes in and the receiver is waiting, the pass would be incomplete. And that is what usually used to happen with regular pneumonias. But if the pass is made but there is no receiver, then also pass is incomplete, which is what is happening with this COVID. So the blood is not reaching the places where the air is going because the small capillaries, the small blood vessels are clogged. And that's causing problem with the hypoxia or low oxygen. And by increasing pressure, this thing is not helped a whole lot. Recently, they did a study where they used clot buster and blood thinners. It was a very small study from New York. They found out that as soon as they delivered it, the oxygenation improved. However, it did not last long. So there is some suggestion that we should be putting people on full dose blood thinner when they have this problem. Another new thing which has come out within last week or so is that the virus is affecting or attacking the red cells or the hemoglobin. When the red cells or hemoglobin is broken down, whatever is released, whether it is iron, porphyrin, whatever it is, it causes inflammatory reaction in the lung. And so the delivery of the oxygen is impaired. The inflammation causes more problem with the barrier of oxygen transfer, and that's also complicating the oxygen delivery. So just to summarize so far whatever I have said, number one, more people are intubated as a choice because we don't want to have the spread by aerosol, but they're also very sick. Number two, the virus is much more infectious than average flu. Number three, there appears to be a problem with the clots or circulation problem in the very tiny capillaries or blood vessels going around the air sacs or alveoli. And number four, the virus seems to be attacking hemoglobin, which is causing more problem with oxygen transfer, as well as causing inflammatory reaction in the lung. So we are learning every day something new. The good news is the plasma, which is liquid part of the blood without the cells, recovered from the patients who have recovered from the coronavirus, seems to be quickly effective. The other medicines are being developed. There are many of them, and I don't think this is a place for me to talk about it. But certainly it looks like that we may have already passed the peak and we may be on a decline. And hopefully, with the grace of God, in next 2 to 4 weeks, the curve will go down enough that we can reopen. I'm as much worried about health and the life of people as much as the economy. And let's hope that cure is not worse than the disease. Thank you for listening. If you like it, please subscribe and tell your friends. I want to state very clearly that this is the information true as of now. I'm sure it will change like every other thing in medicine does. Thank you. God bless you.